get asked how to use a Sonicare properly. So today I'll review a couple simple techniques with you on placement and usage of a Sonicare toothbrush. As you will notice on the toothbrush head, the bristles are longer on the top and bottom of the toothbrush. Most people confuse this and use it incorrectly. They will place the toothbrush straight ahead and use the bristles straight on towards the tooth and the gum. As you can see in this illustration, the bristles are only working on the front and back of the toothbrush. The correct placement for the lower arch is to place the toothbrush bristles down, flex it towards the tooth and the gum, and go in a back and forth sweeping motion. This will be done on the lower rights and lower lefts and across the fronts. You will also take the toothbrush and run across the chewing surfaces of the teeth. For the lower insides, where the tongue is normally here, you will place the bristles down, again flex towards the tooth and the gum, and go in a back and forth motion, on left side as well as right side. The only place you physically move the toothbrush is from eye tooth to eye tooth, on the inside where the tongue placement normally is. You'll take the toothbrush handle and point it up and go in an up and down sweeping motion from eye tooth to eye tooth. You repeat the process on the upper arch. The only difference is that you point the bristles upward, again towards the tooth and the gum, right where they meet, and go in a back and forth sweeping motion for upper left side and upper right and in the front. Once again on the uppers, you will also go over the chewing surfaces where you chew, on right and left sides. On the upper right, on the inside roof of the mouth, you'll again place the toothbrush on the side and use the side of the bristles. And just as we did on the lowers, from eye tooth to eye tooth, you'll hold the handle down for this illustration here and go in an up and down motion. As you will notice on your Sonicare toothbrush, it has a couple different settings. A clean mode is meant for patients to brush for 2 minutes. The toothbrush will shut off automatically after 2 minutes. We advise that you divide the mouth into 4 different parts to equally brush for 30 seconds in each quadrant of the mouth. That can be done in 2 ways. You could brush all the outsides for 30 on the lower arch and then around on the insides for 30. Same thing on the upper, you can brush all the outsides for 30 seconds on the outside and 30 seconds on the inside. The other way to divide up the mouth would be to divide into quarters. Brush from the front tooth back all the way to the upper left molar, from the outsides, the chewing surface, and on the inside. Repeat the same thing for the upper left for 30 seconds. Same thing on the lower, all the outsides for 30 and the insides for 30 for those 30 seconds. And then your last quadrant would be the lower right, from the inside chewing surface and outside. The other mode that's on the toothbrush is set for gum care. That is a 3-minute toothbrushing. That allows our periodontal patients to brush for an additional minute, twice a day. If you have any questions or concerns regarding your new Sonicare, please feel free to email our office and I'll be happy to help you or assist you in any way. Thank you and have a great day.